Hello, this is Amanda Jelinek. This is my chest assessment video. I'm starting by scanning my room. Alright. And before I enter my patient's room, I would check the chart, making sure I have the right patient and orders. And as I enter the room, I would provide privacy by closing the door and or curtain. And then I would perform my hand hygiene and introduce myself. Hello, Mr. Perez. My name is Amanda. I'll be your student nurse today.
Hello.
Can you go ahead and tell me your full name and date of birth?
It's Marco Perez, 7988.
Thank you very much. And what brings you in today?
Just to check it.
Okay. And are you in any pain?
No.
All right. And I'm going to be doing a chest assessment on you today. All right. And starting off, I'm going to go ahead and look over his skin and hair throughout his body. And I'm just going to go ahead and look at all of it once. And as I'm doing my individual assessments, I'll make sure to make note if I find any other findings or abnormalities. So as I look at his arms, if you can put your arms out. And if you can put your legs out too, just so I can see. His color seems to be true to ethnicity. There's no sign of any jaundice or cyanosis. I don't see any wounds or lesions. He does have tattoos all over his upper extremities and on his right side of his neck. But there are a few minor macules, nothing that looks abnormal at all. And then I'm going to go ahead and feel him, his temperature. And as I felt him, he feels warm and dry to touch. I'm going to also go ahead and do his skin turgor. It is nice and elastic, which shows he is hydrated. His skin is also intact. There's no signs from what I see of any pressure ulcers or any tearing at all. And as I go down, I'm going to look at his neck. Looking at his neck, I do not see any jugular vein distension at all on either side. Do you have any history of any lumps in your neck or any issues with rotating your neck at all?
No.
Okay. I'm also going to check the jugular vein distension at a 45-degree angle. So at this time, I'm going to have you move to the couch real quick. I'm going to turn this. You can just lay down slightly and just sit your head up. There you go. And I don't see any jugular vein distension. Excuse me. And you can go ahead and return back. While I'm on his neck, I'm going to go ahead and feel for his carotid arteries, doing one at a time. And if you could just turn, just so I can kind of see where I'm feeling it. All right, and can you turn this way? I'll go on this side. Alright, and his carotid arteries are about a 2+ bilaterally. Now I'm going to listen to the carotid arteries using the bell side of my stethoscope. And I'm going to listen in 3 spaces. As I listen to them, I'm going to have you take a deep breath, exhale, and hold your exhale, and that's when I'm going to listen, and I'll tell you when to take another breath. Alright. Alright, go ahead and take a breath. And let it out. Alright, and take a breath. And let it out. Okay, and take another breath. Let it out. and I did not hear any bruits or any adventitious sounds. And as I move down, I'm going to go ahead and look at the chest. Inspecting again, I don't see any signs of any wounds or scarring at all. Do you have a history of any heart conditions or diseases for you or your family?
No.
No. Any history of asthma or trouble breathing?
No.
Any recent coughs?
No.
No. Are you a smoker?
No.
No. Okay. And I'm going to go ahead and percuss his anterior chest. I'm going to start at the second intercostal space, and I'm going to do the right and left sternal borders, and I'm going to work my way down to the fifth rib. All right, using the Naj Alui to find my second intercostal space. And the sound was resonant. Now I'm going to go ahead and listen to these lung sounds using the diaphragm of my stethoscope. And at each time I put my stethoscope on, you just take a full deep breath and let it out. And the lungs did sound clear on all lung fields. There were no signs of any wheezing or crackles or any adventitious sounds. Since I'm on the front here, I'm also going to check his heart sounds, doing ache to man. I'm going to go ahead and do the right sternal border, second intercostal space for the aortic, and left sternal border, second intercostal space for pulmonic valve. I'm going to move down one to the third intercostal space, left sternal border for the Erb's point, and I'm going to go down to the fifth intercostal space, left sternal border for the tricuspid valve, and move over fifth intercostal space, mid-clavicular line, to do the left sternal border to do the mitral valve. And as I'm listening to this, I'm going to use the bell of my stethoscope. And I did not hear any extra sounds. I did hear S1 and S2, and it was a normal rate and regular rhythm. Also, as I'm looking at the front. Oh no, I think that was it. I'm going to go ahead and turn you around now, sorry. Alright, again looking in the back, no signs of any scars or wounds or any lumps at all. The color is still true to ethnicity. He is still warm and dry to the touch. I'm going to go ahead and do a few things. I'm going to inspect for tactile firmness. I'm going to have you say 99 every time my hands hit your back, okay?
99. 99. 99. 99.
All right, and the vibrations did diminish as I went down, which is a normal finding. I'm also going to palpate for crepitus. Which I do not feel or hear any crepitus. I also did not feel any wounds or any masses or lesions. While I'm back here, I'm also going to percuss his lung field starting at C7 all the way down to T10, and I'm going to use the base of the scapula at T7 to go down 3 spaces to that T10. And while I'm down here, I'm going to go ahead and have you take a deep breath and let it out. And that shows that his symmetric expansion was symmetrical and bilaterally. And I'm also going to look at his AP diameter, which is a 1:2 ratio. Now I'm going to start percussing. And I'm going to start here. And the sound was resonant. Now I'm going to go ahead and auscultate to these same locations using the diaphragm of my stethoscope. Go ahead and take a deep breath and exhale every time I touch. And again, no sounds of any wheezing or rhonchi or any adventitious sounds. The lung fields were clear on all levels bilaterally. Now I'm going to go ahead and have you turn around. did forget to note a couple things in the front, so I just want to address them. As I was inspecting the chest, I did not see any signs of any lifts or heaves mid-clavicular line right here. I also wanted to note that his facial expression was relaxed and there's no sign of any accessory muscles being used. So that shows me that he is not in any respiratory distress. Now I'm going to go ahead and move on to his extremities, starting with the upper extremities. Can you put them out like this? And as you see, his arms are symmetrical. I'm going to have you grasp my fingers. All right, tightly. All right, thank you. And go ahead and push my hands and pull my hands. All right. And I did touch your arms. You were warm to touch and dry. And I'm also going to note that I don't see any signs of any edema in either arms. Now I'm going to go ahead and do a few of his pulses. I'm going to check the brachial and radial. Okay, and that's about a 2+. So now I'm going to check the other side. And that is about a 2+ as well. So they are 2+ bilaterally for the brachial arteries. Now I'm going to check the radial. And this side as well. And that is about a 2+ bilaterally as well. Now I'm going to go ahead and move down to your lower extremities. I'm going to just move the camera a little closer. Hopefully you can see a little better. Okay. You scoot back a little bit. Okay. Looking at the lower extremities, I would check the femoral artery, but for my patient's privacy, I'm not going to. But I will start at the popliteal on each leg. All right, and I'm going to do this other leg as well. And those are about a 2+ bilaterally as well. Now I'm going to move down to his ankle. This camera angle, sorry. I'm going to just lift your leg up. So I'm going to do the tibial, posterior tibial on each side. And I'm going to switch legs. Turn it a little bit. And those are about a 2+ bilaterally as well. Since his foot is perfectly in the camera, I'm also going to check his dorsalis pedis. And I'm going to get the other foot as well. And those are both about a 2+ bilaterally. I did not see any signs of edema on his lower extremities, and I am going to check his cap refills on both of his upper and lower right now. And those are all less than 3 seconds, which is good. And the same with his right upper extremity. Now I'm going to check the cap refills on his lower extremities. If you can hold your foot up one more time. All right. And those are less than 3 seconds as well. Other foot. Thank you. and those are about less than 3 seconds as well, which is a good finding. Now that I'm on your feet, can you go ahead and raise your legs? Let's see if I can see it a little better. You can raise them up on your own. All right. And now I'm going to have you push against my hands with your feet. And push. Yeah, there you go. Pull against and push. Thank you. All right. And range of motion for his lower and upper extremities seem to be intact. And all of his peripheral vascular arteries were all at 2+ bilaterally. I would also assess his temporal artery, but it is not considered peripheral vascular. And after I am done with my assessment, I would go ahead and document all of my findings. And that's it.